For some people, fibromyalgia is a condition that just seemingly never goes away. They always have symptoms, and just the conventional models maybe aren't helping, and they don't know where to turn, and they don't know the root of the actual problem. So I've been a doctor now for almost 3 decades, and our focus has been on the nervous system, and it's on a versions of healing that you maybe never heard of, and taking care of the body in a way that's completely different, but yet very effective and gets results for you. So I hope you enjoy this conversation, and I hope it gives you some enlightenment and some hope that there are therapies, there are techniques, there are methods that can help you get out of this fibromyalgia situation.
Today I'm here with Dr. Chris Cormier, and we are going to be talking about fibromyalgia. Hello, Dr. Cormier.
How are you, Cameron?
I'm doing great today. When people come to you with fibromyalgia, what do they say hasn't made sense about their diagnosis or treatment?
So they don't really understand where it's coming from and what the root cause of it is. And they're just confused as to whether or not they're just going to be on drugs that are temporarily band-aiding their symptoms for the rest of their life.
At that stage, what are they most afraid of hearing or not hearing from another doctor?
That they can't help, that they don't know what's causing it, that they don't know any particular solutions. Also, that they can't get relief from anybody that they're seeing. When they go have any type of therapy for their condition, they don't leave feeling better oftentimes. Or if they go to conventional where they just do medicines, they have to wait on the particular medicine to get them some relief, but then that doesn't really fix the actual problem. It always comes back.
Why does fibromyalgia pain fluctuate instead of resolve?
So it's an autoimmune condition, and as we talked about with autoimmune conditions, they revolve around cell health. That's kind of what your body is. You have about 30 trillion cells, and you want to think of it as the more unhealthy cells out of those 30 trillion, then if that group of unhealthy cells gets too big in any area, then the healthy cells want to get rid of the unhealthy cells, and this internal war starts. And that's what autoimmune is, your body trying to protect itself. But so I explained it a little different than conventional, where conventional says it's the immune system attacking your cells, but that's not what I believe. I believe it's the body actually protecting itself from too unhealthy cells trying to hijack and take the body over.
100%. Why do symptoms worsen with stress, poor sleep, or emotional overload?
Yeah, so remember there are 30 trillion cells, and each person on a daily, minute, second of every day, you have stress. And the types of stress you have are physical stress, which would mean like postures, and you also have any type of or injuries with physical. You also have emotional stress, like anything happens small or big emotionally at any given time. And then you also have environmental stresses, which is massive in today's day and age. You got chemicals, pollutants, toxins, additives, 5G, Wi-Fi, and the list just goes on and on. And any of these stresses at any given time can affect groups of your cells in your body. And an example would be, let's say you have a small injury, maybe it's a fall. You can have some damage to cells that get unhealthy, and if you don't get those cells healthier, they may just stay unhealthy for the rest of your life. And that could be an emotional event, same way. We've seen this where a big emotional event happens and they can't talk. So the nerves that make you talk shut off after that emotional event. That's crazy to think about. And then on the environmental side, you can eat something or have a chemical get into your system and it start to shut off some cells. So there's so much to think about when it comes to cell health.
Yes. Many patients are told nothing is damaged. Why doesn't the body behave that way?
So your body is designed to heal itself. So technically, you should feel fantastic all the time, theoretically, the way God designed you. But unfortunately, there's so much interference for our cells and our bodies on the planet that you end up having these stresses to your cells, cause damage, and your body just struggles to self-heal. So you have to use the right resources to be able to get your body to heal itself.
What early warning signs of nervous system overload are most often dismissed or normalized in fibromyalgia?
So aches or pains. Typically, you'll have a sensitive, something that doesn't feel right, and you're like, oh, it's just going to go away. Oh, I'm just going to take, over meds for it. Well, those things kind of just hide the symptom, but don't actually fix the unhealthy cells. And so you definitely want to make sure if you've got any symptoms like this that are staying over and over, repetitive, where they're coming, going, and coming and going, and they're starting to increase in multiple areas, these are.
When someone with fibromyalgia walks into your clinic, what do you notice immediately that imaging and labs never show?
So the big thing we do here is with every person walking through the door, they're through our office, we're gonna treat you vastly different than other healthcare practitioners because we look at your body as a whole. So we want to first get to know you and then understand everything that you've been through in your life, your physical stresses, your emotional stresses, your environmental stresses. And then once we do that, we do a very, very detailed exam where we actually assess your power. And you want to think of your brain being your power company, and it's wired to trillions of cells. That's the only way those cells, they have to have a power company, right? So your brain, it's not, I was gonna say difficult, but it's impossible in today's world for your brain to stay 100% powered up to all these trillions of cells because of so much interference. So when we do this original exam, there's 88 primary nerves. So you have your brain and your spinal cord. There's 88 primary nerves that come off, starting from the top all the way down to the bottom. And those big power lines, they're like power lines, they branch all the way to microscopic and they go to every cell in your body, which is just crazy how we're God made. So those cells, if they lose power, then they get sick. And so the examination we do examines the power in those 88 nerves. And that way we understand where that person's power outages are. And the brain, from the moment they start to come here, their brain starts to actually start healing. Because when the brain feels a power outage, a specific one, then it starts to recover.
Wow. Why does the nervous system stay hypersensitive long after the original triggers are gone?
So each person is going to vary when it comes to this condition. Some are more sensitive than others. That's why we have to take a very calculated approach with each individual, and we individualize plans for people coming to see us because each person's going to require, some people can take more intervention faster, and then other people can't. We have to go slower. But we adjust accordingly, and we do our best to get people as well as possible, as fast as possible.
Amazing. Why does the body amplify sensation before logic or reassurance can intervene?
So the body really wants to be healed. It wants to do its own healing internally, but it loses that capacity. And so this internal healing, big pharmaceutical companies, they don't want you to know anything about self-healing. They don't want you to think your body heals itself, but it's designed to heal itself. And examples would be like, let's say, you have a cut. Well, if you cut healthy cells, they're gonna heal and you're probably not gonna see a scar. And we take it for granted when it does, but it's amazing. You don't have to push any buttons or anything, your body just does it. But if you cut unhealthy cells, sometimes it takes longer to heal and you end up with a scar because the body just couldn't efficiently do a good job. And then the worst case scenario is if these are so unhealthy that you cut them and they don't heal. And that happens to people. So those scenarios are out there, and we have to do our best to try to spark up the health in those cells and get them healthier.
What actually changes when fibromyalgia affected nervous system begins to finally feel safe again?
So the person feels tremendously better. They go from maybe having pain all over, not being able to be touched in certain areas because of it, very, very tender, to all areas getting tremendously better. And the big thing what we do here is not only we help all of our patients to get but we want to teach them what to do to help themselves at home. So our best patients, what they end up doing is they learn so much from us that they're able to need less after they get a corrective program that we have.
Wow, that's awesome. Many patients are later told that they have an autoimmune condition. Why does that overlap happen so often?
Fibromyalgia is an autoimmune condition, but you can get multiple autoimmune conditions together. And oftentimes we see that, right? So not just connective tissue may be autoimmune, it could be nerves that get autoimmune, it could be organs that get autoimmune, it could be muscles. I mean, there's all kinds of parts of the body, even the gut, it could be autoimmune. So the most behind it is the more unhealthy cells you have, then of course they can get autoimmune can turn on wherever those.
In your experience, how often is autoimmune a label applied to chronic nervous system deregulation?
So the nervous system is the strength of the nervous system, how well connected your brain is to your cells dictates your health. So the better your brain is connected, because it's your power company, it powers everything, right? So and you should think about this. It not only powers all the cells. You're probably thinking maybe just generic cells. Well, there's muscle cells, there's bone cells, there's skin cells, there's organ or gland cells in your body. So that nervous system's giving power to all those cells, and it's so important. The less your brain is to those cells, then those cells become diseased and get sick and can develop these types of conditions.
What happens when fibromyalgia is treated purely as an immune or inflammatory disorder?
So from that perspective, conventional, they'll just lower the immune system, right? They think it's the immune system attacking the body, so they give you meds to lower the immune system. Well, of course, that's not going to fix the problem. And in fact, it can actually make things worse. You can imagine if you're suppressing your immune system, of course, you can get more, right, to your body. So my philosophy of helping people with autoimmune is strengthening unhealthy cells and boosting the cells, getting them healthier, making the body do what it's designed to do, getting it to self-heal again. And we use many different tools. It's not just the brain's power to the cells where we're making the nerves function better. We're also doing basic ingredients like oxygen. We're getting oxygen gas back to the cells. We're making sure the cells are hydrated properly with water. We're also using frequencies to be able to help.
You talked about like suppression-based approaches. Why can those intensify pain and fatigue instead of resolving them?
So those types of techniques they can be a lot of side effects with taking medication. And again, I'm just going to make sure I can't tell people to take medication or not to. That's up to you. But we're the type of clinic where we're the reverse. We're gonna actually work on your body's ability to self-heal, because certainly when you are taking those medications, whatever they are, you can have adverse reactions to medications, and just the route taking with those medications by suppressing the immune system really, in my opinion, is not the right route.
You work with frequency-based therapies in your clinic with fibromyalgia and autoimmune labeled cases. What is the body responding to?
Okay, so frequency, you can go back to Einstein in the early 1900s, and he said frequency is going to be the future of medicine. He was absolutely right. So frequency, I want you to think of your 30 trillion cells in your body. Every single one has its own tune or frequency. Like, for instance, your thyroid cells have a different tune than your large intestine cells, than your kidney cells, than your adrenal gland cells. Every cell has its own tune, like a guitar string. And you want each cell to stay tuned up to its radio station tune. That's the way to think of it. If it gets off its tune, then it can't do its job. And so luckily we've been using frequency for years, but now we have just these devices, and it's so nice because not only do we have what we consider to be the best technology here, but I always wanted to help patients 24/7, but I can't go with them. So now we've developed a system where you have frequency devices that they can use for home. So they can use these 24/7. I mean, there's settings for pain and all types of stuff in here that will target certain cells that people have problems with fibromyalgia.
Wow, that's amazing.
It's really amazing.
Why are fibromyalgia patients often extremely sensitive to aggressive treatments or protocols?
Well, because their nervous system, their bodies, their cells are already so weak that you have to really use intervention to get them better. So somebody who comes into my office with fibromyalgia so bad that, going like this to touch them, they hurt, right? You can't even get your hand on them because they hurt so bad. If I just walked up to them and really pushed, I would probably the cells too much. So we have to slow them in those types of patients and strengthen that nervous system gradually to where the cells start to come back to life. It's like the power company getting power back to the cells, and you got to do that with a very specific method.
What happens when the nervous system receives signals it no longer needs to defend against?
Yeah, so the nervous system is there for all kinds of things. The brain is like this big power company, and it has to keep aware of what's going on in the body. And sometimes what's happening is the cells get so unhealthy, the brain loses connection to them, and it doesn't know what's going on in those cells. So we have to get that connection back, make the brain realize what's going on, and try to get that power restored.
Why does regulation matter more than pain control at this stage?
So it has to be systematic. You've got to do the things to these cells to get them to come back, because otherwise your body will stay in this state of not healing. And really, when it comes to it, there's a couple sides of your nervous system, and one is on the healing side and one is more on the surviving side. And these types of cases, the surviving side's working way stronger than the healing side. So we've got to boost that healing side back up and get the body to heal its own cells so that you can do this condition and get over it.
We've seen many public figures, including Morgan Freeman, openly about living with fibromyalgia. Why doesn't success, money, and access eliminate the pain?
It really is information. And unfortunately, on the internet, when you're searching for things, Google censors things. A lot of engines, they don't want you to know about the things we're talking about. They want you to go towards conventional, and they want you to do drugs, injection, surgeries, because it's such a massive, those are such massive companies with such, what's the word? I'm trying to think of they have power over the market. So that's where they want you to go. Whereas, small businesses like me, where I've been doing this for almost 30 years, we've made so many discoveries, and we're all about self-healing. So in my world, I would try to get people to keep healing at a maximum for their whole life until God's ready to pluck them, until you pass away. So, but on the side, they want you to be going towards a 5-gallon bucket of pills in a nursing home. So we're vastly different in the way we think, but that's this condition. If you're more holistic, natural, we have the best of the best to be able to help with this particular condition.
What does that reveal about how misunderstood fibromyalgia is?
Yeah, so from our perspective, I've already touched on kind of the way I think about autoimmune versus everybody else, but in particular, fibromyalgia, I think people believe that it's permanent. Like once they get it, I think they have it forever. And it's not at all. You can totally reverse it, but you have to do the right things. And you have to make sure whoever you're seeing for it, they're using the resources and methods and techniques. And unfortunately, today's day and age, there's too much information. So people go to find somebody like us, and they find people, and then they give up and think, that none of that worked. And then we have somebody else that maybe goes through 3 people, and they come to us. And I wish everybody came to us first. And that's why we're doing this, to educate people on what's possible.
What do these cases expose about the limits of conventional pain-focused models?
So fibromyalgia, when it comes to conventional, they really have doing anything other than just medicating, right? So, and you can, if you're in pain all the time and you're just taking a bunch of pain meds, I think people understand the longer they're on pain meds, it's going to lead more and more pain meds, and it's not going to ever really resolve why the pain is there in the first place. But think of a cell, when it's disconnected from the brain, it starts crying. It literally starts crying. And it's like saying, it'll give you pain, it'll give you discomfort, it won't allow you to touch it. It's like a cell, and it needs to get its power back. And that's the essence of this. It's not pain is not what people perceive it to be. It's in a medication. It's an actual disconnected cell.
Yes. If someone has been told that they have fibromyalgia and possibly even another autoimmune condition, what assumption needs to be questioned first?
So the assumption is that they have more, many more cells that are unhealthy. Because remember, that's how this autoimmune thing starts, is the more unhealthy cells you get, the more likely you're going to get autoimmune conditions. And that's why I think when I first started practicing, there was maybe 2 autoimmune conditions, and now there's like almost 200.
Wow.
I mean, they just keep giving names for these conditions, but essentially it's dysfunctional cells, it's unhealthy cells throughout the body. So the more types of autoimmune conditions you have, the more types of cells that are involved that are getting dysfunctional.
What keeps you working with fibromyalgia cases that others will literally just give up on?
We have the resources, we have the methods, we have the techniques to get people results. And one of the things that people come here for at the Nerve Health Institute is they get to experience, if they come in with pain, for instance. This is hard for people to imagine, but if you're an out of 10 pain, can you imagine seeing a clinic, going to and that pain going down to a 1?
Wow. No, not at all.
Real time.
Wow.
Real time. Powerful the body is when you do the right things. So that's what we see every single day, and we have for many years, is people will come in, let's say, with that 10 out of 10 or 7 out of 10, and we're able to get that pain on every visit to go down to a minimum of 50% every single time.
That is amazing, amazing. What is the most damaging sentence a fibromyalgia patient can hear early in their journey?
That it's permanent. That it's a label they'll never get rid of. It's like somebody puts a name tag on you that you have it, and or tattoos it in your body, and you say, I just have it forever. It's not there. It's not the case. Or I'm going to take medication for the rest of my life. Or if they don't like medication, I'm just going to suffer for the rest of my life, and this is going to potentially get worse, and I'm not going to be able to do A, B, C, D, F, G, with my family, and I'm not going to be able to pick up my grandchild or go to the grocery store, or just the stuff that we normally do, or go on vacation, or do your job. I mean, all the things that you normally would do. So it's the right methods and techniques.
Awesome. Well, I think that was a very informative conversation. That is it for today. Thank you very much, Dr. Cormier.
Thank you.
So if this conversation resonated with you, just know that there is hope. There are procedures, there are methods, there are techniques that you can do at home to be able to help you with this condition that you probably have never heard of. And that's why we have a company we developed. It's called Body Chargers. We have full access to all the different things we would recommend for conditions like fibromyalgia. We also have, if you want to take deeper measures to help you, you can come to the Nerve Health Institute. It's our clinic, and we have even better, higher sophisticated methods that we can use to be able to help you with this condition. And chances are you haven't heard of much of this, and that's the purpose of doing this video. So we're here for whatever you need.